Skeleton of the foot. Welcome to today's session on the skeleton of the foot. In this video, we will cover the classification and arrangement of foot bones, tarsals, metatarsals, and phalanges, detailed features of each tarsal bone, navicular, cuboid, and cuneiforms, the structure, attachments, and ossification of metatarsal bones, the types, arrangement, and ossification of phalanges, important clinical correlations, including Jones's fracture and March fracture. Let's begin our study from the tarsal bones, moving forward step by step. The skeleton of the foot from behind forward consists of the following bones: tarsals, metatarsals, phalanges. These are short bones which together form tarsus. These are arranged in 3 rows. Proximal row consists of talus and calcaneus. Middle row consists of navicular. Distal row consists of 3 cuneiforms, that is, medial, intermediate, and lateral and cuboid. Navicular bone. The navicular bone is boat-shaped. It is flattened anteroposteriorly and presents 6 surfaces: anterior, posterior, dorsal, plantar, medial, and lateral. Anterior surface is convex and possesses 3 articular facets for 3 cuneiforms. The medial facet is the largest. Posterior surface is deeply concave and articulates with the head of Talus. Dorsal surface is convex and rough and provides attachment to the dorsal talonavicular ligament. Plantar surface presents a groove in its medial part through which passes the tendon of tibialis posterior. Its lateral part provides attachment to the spring ligament. Medial surface projects downward to form tuberosity of navicular bone, which provides insertion to the major part of the tendon of tibialis posterior. Lateral surface is rough and may present a facet for cuboid. Cuboid bone. The cuboid bone, as the name implies, is cuboid in shape. It is situated in front of calcaneum and behind the 4th and 5th metatarsals. It presents 6 surfaces: anterior, posterior, dorsal, plantar, medial, and lateral. Anterior, distal surface presents medial quadrangular and lateral triangular articular facets, which articulate with the bases of 4th and 5th metatarsals, respectively. Posterior, proximal surface presents a concavo-convex articulate facet, saddle-shaped articular facet, for articulation with the anterior surface of the calcaneum. Dorsal, superior surface, is rough and flat. It is directed upward and laterally and provides attachment to dorsal ligaments of the foot. Plantar, inferior surface, presents an oblique groove in its distal part for the passage of tendon of peroneus longus. Medial surface presents two articular facets, a large distal oval facet and a small proximal oval facet, which articulate with the navicular and lateral cuneiform bones respectively. Lateral surface is small and grooved by the tendon of peroneus longus. Cuneiform bones. In Latin, cuneiform means wedge-shaped. These bones are wedge-shaped and three in number: medial, first cuneiform, intermediate, second cuneiform, and lateral, third cuneiform. The medial cuneiform is the largest, and the intermediate cuneiform is the smallest. Proximal surfaces of cuneiforms articulate with the navicular bone. Distal surface of medial cuneiform articulates with the base of first metatarsal. Distal surface of intermediate cuneiform articulates with the base of second metatarsal. Distal surface of lateral cuneiform articulates with the base of third metatarsal. Metatarsal bones. These are 5 miniature long bones. The 5 metatarsal bones together constitute the metatarsus. They are numbered from medial to lateral sides as first, second, third, fourth, and fifth. Identification. First metatarsal. It is the shortest, thickest, and strongest, and is adapted for weight transmission. Proximal surface of its base presents a kidney-shaped articular surface. Second metatarsal. It is the longest metatarsal bone. Proximal surface of its base has a triangular concave articular surface. Third metatarsal. Proximal surface of its base has a flat triangular articular facet. The lateral side of its base has 2 facets, while the medial side has 1 facet. Fourth metatarsal. The proximal surface of its base has a quadrilateral facet which articulates with the cuboid. The lateral side of base has 1 facet, while its medial side has 1 facet, divided into 2 parts, proximal and distal. Fifth metatarsal. The lateral side of its base projects proximally and slightly laterally to form a large tuberosity styloid process. Features and attachments. Each metatarsal consists of 3 parts. Distal end, head. Shaft, body, and proximal end, base. Head. It articulates with the base of corresponding proximal phalanx to form the metatarsophalangeal, MP, joint. Shaft. Its plantar aspect is concave, from before backward. Sides of the shaft provide attachments to the interosseous muscles. Plantar aspect of the 5th metatarsal gives origin to the flexor digiti minimi, Base. Base of the first metatarsal provides insertion to tendon of tibialis anterior, inferomedially. Tendon of peroneus longus, inferolaterally. Plantar aspects of bases of middle 3, 2nd to 4th, metatarsals provide insertion to slips of tibialis posterior. Base of the 5th metatarsal provides the following. Attachments. Peroneus brevis is inserted on the styloid process of base. Peroneus tertius is inserted on the dorsal aspect of the base. Flexor digiti minimi brevis originates from the plantar aspect of the base. Ossification. Each metatarsal ossifies from 2 centers, 1 primary and 1 secondary. Primary center for shafts of all the metatarsals appears during 9th week of IUL. Except for the shaft of first metatarsal, which appears during 10th week of IUL, secondary center appears during 3rd to 4th year. In the heads of all the metatarsals, except in the first metatarsal, where it appears in the base, all of them join with the shaft during 17 to 20 years. Applied anatomy, fracture of the tuberosity, styloid process of the 5th metatarsal. It usually occurs due to forced inversion of the forefoot when the tendon of peroneus brevis pulls off the styloid process, leading to its avulsion. This fracture is also called Jones fracture, after the name of an orthopedic surgeon, Sir Robert Jones, who himself sustained this injury. March fracture. It typically occurs in the shaft or neck of 2nd and 3rd metatarsals due to aggressive prolonged march past by the soldiers. Phalangeal bones. The phalangeal bones are miniature long bones. They are 14 in number in each foot, 2 for the great toe and 3 for each of the other 4 toes. The phalanges in the great toe are proximal and distal, and phalanges in other toes are proximal, middle, and distal. The base of the proximal phalanx presents a concave facet which articulate with the head of metatarsal bone to form the metacarpophalangeal joint. The distal end of the proximal phalanx presents a pulley-like articular surface and articulates with the middle phalanx in the lateral 4 toes and with terminal phalanx of first toe. Thus, lateral 4 toes possess 2 interphalangeal IP joints, proximal and distal, and the great toe possesses only 1 IP joint. Both proximal and distal articular surfaces of the middle phalanx are pulley-shaped. The distal phalanx of each toe bears a rough tuberosity. On plantar aspect of its distal end, ossification. Each phalanx ossifies from 2 centers, a primary center for the shaft and a secondary center for the base. The time of appearance of primary centers is as follows. For proximal phalanges, 12th week of IUL. For middle phalanges, 15th week of IUL. For distal phalanges, 9th week of IUL. The time of appearance of secondary centers is as follows. For proximal phalanges, 2 years. For middle phalanges, 4 years. For distal phalanges, 8 years. The fusion of epiphysis, base, with diaphysis, shaft, occurs in about the 18th year, and that's the skeleton of the foot, built for support, balance, and movement. Thanks for watching.